Mama, what is leprosy?
Leprosy. When you hear the term, it probably conjures images of people who suffer from great facial deformity or have limbs that have been irreparably damaged by a disease that many thought only existed thousands of years ago during biblical times. But unfortunately, the sad reality is that hundreds of thousands of people across the globe are still afflicted with this disease. A disease that not only causes great physical pain and discomfort, but also results in isolation and abandonment by the very societies that once embraced these people. Across the world, these people who suffer from the effects of leprosy are often abused and neglected. And not only they, but their family, their spouses, their children are outcast from society, forced to live in isolation, forced to suffer alone.
Most lepers are the poorest of the poor in their societies. The disease rarely infects people with adequate hygiene. Lepers are victims of societies lacking sufficient sources of food and water. When a person is infected with leprosy and cannot get proper care, they will suffer from sores and blisters like these. Leprosy is an infectious disease caused by Mycobacterium leprae. The clinical presentation of the disease is dependent upon the response of the host to the organism. The tuberculoid forms occur in a person who is infected but is able to generate a granulomatous response to contain the bacteria. The lesions are localized and are not infectious. The peripheral nerve damage is often rapid and unilateral, giving rise to anesthesia, muscle weakness, and/or impaired sweating. Lepromatous leprosy, another form of the illness, occurs in persons who fail to develop an adequate immune response. People who suffer from this variety of the disease include AIDS patients. As the enormous number of bacteria multiplies without any constraints, it can spread quickly into deeper layers of the skin and bones, as well as the other organs of the body. The bacteria preferentially invades the eyes, testes, and muscles of the victim. Thus, the patient could develop blindness, facial deformities, and multiple organ complications. Furthermore, gradual bilateral destruction of nerves leads to a loss of sensation in the distal extremities and eventually to much of the trunk. Oftentimes, burns or lacerations in anesthetic areas become infected without the person even being aware. The current treatment of leprosy involves multi-drug therapies such as dapsone, rifampicin, clofazimine, ethionamide, and protonamide. The combined drugs were found to be more effective than a monotherapy of dapsone because they can prevent the growth of mutant-resistant strains. This means that in a multi-drug therapy, a strain which can survive drug A will most likely be killed by the second drug, drug B. Thus, strains resistant to drug A will be unable to pass on the resistant trait to the next generation. The effectiveness of the therapy also requires the patient to take the drugs regularly and in the prescribed duration. Thus, the adequacy and availability of medical support is critical in monitoring and treating the disease. Leprosy is a disease that can be combated today by better sanitation, eradication of identified sources of infection, and the continuing development of therapeutic agents. The human suffering associated with the disease is intense and is a result of physical deformities and related social problems. Thus, success in solving the problem of leprosy ought to be measured not only by the restoration of health, but also by the restoration of individual dignity.
What can we do to help the lepers?